Hello and welcome. Today we're diving into a serious lung condition known as diffuse alveolar damage, or DADE. This condition represents a severe form of acute lung injury, characterized by widespread damage to the tiny air sacs in your lungs, the alveoli. We'll explore what causes DAD, how it affects your breathing, and what can be done about it. Let's get started. So what exactly causes DAD? The causes are varied, but often involve severe insults to the lungs. One of the most common culprits is acute respiratory distress syndrome, or ARDS, which itself can be triggered by infections like pneumonia, sepsis, or even severe viral infections like influenza or COVID-19. Other potential causes include trauma, aspiration of stomach contents, toxic inhalations such as smoke or certain chemicals, drug overdoses, radiation exposure, and even certain autoimmune diseases. Essentially, anything that severely inflames and damages the lung tissue can potentially lead to DAD. To understand DAD, we need to look at what happens inside the lungs. Normally, the alveoli allow oxygen to pass into the bloodstream and carbon dioxide to be removed. In DAD, the initial injury causes an inflammatory response. This response leads to the release of inflammatory cells and mediators, increasing the permeability of the alveolar capillary membrane, the thin barrier between the air sacs and blood vessels. This increased permeability leads to fluid and protein leaking into the alveoli, causing pulmonary edema. Hyaline membranes, composed of protein-rich fluid and cellular debris, form along the alveolar walls, further impairing gas exchange. This results in a reduced ability of the lungs to transfer oxygen into the blood, leading to severe hypoxemia or low blood oxygen levels. Determining the precise epidemiology of DAD is difficult, as it's often considered a pathological finding secondary to other underlying conditions. Because DAD is strongly associated with ARDS, the incidence of ARDS offers some insight. ARDS affects hundreds of thousands of people worldwide each year, and DAD is a common finding in patients who have ARDS. Those at higher risk are individuals who are critically ill, hospitalized, or have pre-existing lung conditions. The signs and symptoms of DAD are typically those of acute respiratory distress. Patients usually experience shortness of breath, rapid breathing, and a persistent cough. They often struggle to get enough oxygen into their blood, leading to a bluish discoloration of the skin and lips, a condition called cyanosis. Because the lungs are filled with fluid, crackling sounds called rales can be heard during a lung examination with a stethoscope. These symptoms can rapidly worsen, requiring mechanical ventilation to support breathing. Diagnosing DAD can be challenging, as it requires a combination of clinical assessment, imaging, and sometimes a lung biopsy. Chest X-rays and CT scans are used to visualize the lungs and look for characteristic findings such as widespread infiltrates and consolidation, areas where the air spaces are filled with fluid or debris. Arterial blood gas analysis will reveal low oxygen levels and often elevated carbon dioxide levels in the blood. The definitive diagnosis often requires a lung biopsy, which involves taking a small sample of lung tissue for microscopic examination. This allows pathologists to identify the characteristic features of DAD, such as hyaline membranes and alveolar damage. While DAD itself doesn't have distinct types, it's important to recognize that it represents a stage or manifestation of acute lung injury arising from various underlying causes. The specific trigger for the initial lung injury contributes to the disease's presentation and influences treatment strategies. Therefore, management focuses on addressing the underlying cause while supporting lung function. The treatment of DAD primarily focuses on supportive care and addressing the underlying cause. Mechanical ventilation is often necessary to provide adequate oxygenation and remove carbon dioxide. This can involve using specific ventilation strategies, such as low tidal volume ventilation, to minimize further lung injury. Prone positioning, where the patient is placed on their stomach, can also improve oxygenation in some cases. Medications may be used to treat the underlying cause, such as antibiotics for pneumonia or antivirals for viral infections. Diuretics can help remove excess fluid from the lungs. Overall, the goal is to support the patient's breathing while allowing the lungs to heal. Preventing DAD largely involves minimizing the risk of developing the conditions that can lead to it. This includes practicing good hygiene to prevent infections, getting vaccinated against influenza and other respiratory viruses, avoiding smoking and exposure to harmful inhalants, and promptly seeking medical attention for respiratory illnesses. For those at risk of aspiration, such as individuals with swallowing difficulties or impaired consciousness, preventative measures should be taken to minimize the risk of aspiration pneumonia. The prognosis for DAD varies depending on the severity of the condition and the underlying cause. DAD carries significant morbidity and mortality. Recovery can be prolonged and may involve persistent lung damage or scarring, a condition called pulmonary fibrosis. Recent research has focused on identifying biomarkers that can predict the development of DAD and on developing new therapies to reduce lung injury and promote healing. Stem cell therapies and targeted anti-inflammatory agents are being investigated as potential future treatments for DAD and ARS. Research is also ongoing to optimize ventilation strategies and improve supportive care for patients with this challenging condition.